striking because the government is not honouring a peer review body's award of 1%. It's not even as much as Midwives or all the staff in the hospital are worth. But that's why we're striking, that's why we're taking action, because nobody's listening. We've had 4 years of reduced pay.
We're here to show Jeremy Hunt that we're really angry that he's not honoured the 1% pay rise that was recommended by the independent peer review body. We do feel we deserve it, whilst we'd never want to jeopardise any women or babies. We do feel that we're worth this 1% pay rise. We're working incredibly hard. We're always making sure that the women and babies are receiving the utmost care. We work incredibly hard. We've seen the birth rate in this country rise steadily, which has increased the amount of women through our doors, increased steadily. So we are working very, very hard. Well, as midwives, we've never been out on strike before the RCM members. It's over 30 years since Unison has called its members out over pay. Jeremy Hunt's got backed into a corner. We don't want to strike. We're not a profession that enjoys striking at all. So I think if Jeremy Hunt's not prepared to listen and come to the table and negotiate with the health unions, then I think we might see more of these flash strikes occurring.
We want to raise public awareness, and we want to hopefully tip the government over into actually listening to us. We have made sure that the unit is covered and that there's nobody that needs critical care isn't being looked after.
And finally, Becky, one final message to Jeremy Hunt.
Give us our pay rise, we deserve it, we know the money's there. There's been top-down reorganisation that's cost a conservative estimate of 1.5 billion, so I think the fact that he can organise from the top down, I think he needs to start looking after the workers on the shop floor and show that he does appreciate work.